This video will be about septic shock. Septic shock is caused by an infection in the bloodstream when the patient is septic. It causes a significant drop in the blood pressure, and it can lead to respiratory and heart failure, stroke, and failure of other organs. It is life-threatening, and it causes inflammation throughout the body. The inflammation blocks the oxygen and nutrients from reaching the vital organs in the body, and it is the most common cause of death in intensive care units in the United States. Some symptoms include a fever, usually higher than 101 degrees Fahrenheit, chills, anxiety, altered mental status, tachycardia, tachypnea with greater than 20 breaths per minute. Lips and digits will be blue or ashy in color. Skin is warm and flushed. Decreased urinary output, nausea, vomiting, difficulty breathing, and fatigue. The hemodynamics will be monitored using a Swan-Ganz catheter. The patient will be hypotensive. Pulmonary capillary wedge pressure will be increased. Cardiac output decreased. The SVR is increased. The mean arterial pressure will be decreased. The CVP will be normal or increased. And the venous oxygen will be decreased. These hemodynamics are based off of late septic shock. Some medication options are antibiotics to fight that infection that's in the blood, oxygen to treat the hypoxemia. Vasopressors will increase the blood pressure and increase cardiac index and the SVR. The preferred or first line vasopressors are dopamine and norepinephrine. Some people prefer the norepinephrine over the dopamine just because it has fewer heart effects. Steroids are also used to decrease the inflammation. It's been shown in studies that if you use a long course of low-dose steroids, it has a better effect than using the short course, high doses of steroids. You'll need to give the patient fluids to replenish the fluids in the body. Aggressive action to replenish the fluids with a strategy to target a CVP of less than 4 millimeters of mercury was associated with a fewer number of ICUs and ventilator days. So it's proven to shorten their stay on the vent and in the ICU. ABG values are as followed. You're going to have an increase in the pH, a decrease in the CO2, decrease in the bicarb, and a decrease in the PaO2. So it'll be a respiratory alkalosis with a low bicarb and hypoxemia. Ventilator treatment for a patient in septic shock will be invasive mechanical ventilation to secure the airway. And you're going to use the ARDS protocol when you're applying the initial settings. So you're going to need to use the low tidal volume of the 4 to 6 mLs per kg of ideal body weight. Low levels of PEEP are safe, and initially they will need to be on full ventilatory support. And here are my sources.